This video is about my S1 L5 laminectomy. My surgery was November 18th, 2022. I am 8 days in recovery, I guess you would say. After surgery, my feet stopped tingling, the hurting, everything was completely gone when I woke up. As time progressed, the next day, um, it was tingling just a little bit. I noticed the more I would walk, the more the tingling, pins and needles, um, would start. I can say that the pain, the sciatic pain that I was having in my left leg, oh my God, it is such a relief to not have this pain anymore. This was a 24-hour constant pain from just below my butt cheek all the way down to my ankle. What I am noticing right now is when I take my hand and I rub it on the back of my thigh, it feels really funny. It feels like I almost can't really feel it. It's a tingling kind of like thing. Um, it's the same thing when I touch the back of my calf. My cramps were, oh my God, they were so bad. They would wake me up in the middle of the night. And I couldn't get back to sleep because the cramps and Charlie horses would not stop. I'm going to show you what I used when I would wake up with the Charlie horses. This is a rolling pin. Yes, the same kind of rolling pin that you roll a pastry with. I would take this rolling pin and roll it down the back of my leg, the back of my thigh, and the back of my calf, until it was gone. My doctor prescribed, I think it was cyclobenzaprine. It was 5 milligrams. Those things were doing absolutely nothing. I was taking that. I'm also on 300 milligrams of gabapentin that I take 4 times a day, and the 1,500 milligrams of Tylenol. And I still couldn't get any relief. The only relief that I got was from the surgery that I just had November 18th. Um, my right foot, the tingling is not as bad anymore. So I'm hoping that this is just the nerves trying to heal. This has been over a 4-year battle for me. This is my second surgery. The first surgery was in the same position, S1 at L5. And that was in May of 2021. Um, I was sitting on the side of my bed drinking some orange juice, and I coughed. And that cough is what blew my back out. All I could do was cry, and I had to pee. So I dialed 911 and I told them what happened, and they dispatched an ambulance. I walked to my bathroom from my bedroom with my chest to my knees. I could not stand up straight. I used the bathroom and then I came downstairs, and I got halfway down and I couldn't bear the pain anymore. And um, me and my mother share a home together, and she said to me, she asked me, was I all right? And I couldn't even answer her. All I could do was cry. It hurt. Oh my God, it hurted so bad. Um, I was taken to the hospital where I was given morphine that didn't work, and I was given, I think it's called Dilaudid. That seemed to be the only thing that could help ease the pain. I was admitted. For 2 days, I was for 2 days, I was bent over. Actually, the second day when I woke up, I was laying straight, and I was scared to move because I didn't want it to happen again. Well, I was told that I would be staying because I was going to have emergencies, back surgery, and that I had a lot of inflammation. So the plan was to get the inflammation down and then have the surgery. So I was in the hospital for about 10 days. And about the seventh day was when they did the surgery. And I got up and I walked around. I was walking around the nurse's station. And again, after the surgery, the pain was gone. Halfway back, my both feet, they went to hurting so bad, um that I started crying, and we had to make our way back to my room. I actually had to do that in a wheelchair because they were hurting so bad. um so like I said, this is the second surgery. The same doctor. I don't think it's anything that he did wrong. I think I was probably just unlucky. So I don't have any pain in my back anymore. Every now and then, I would feel maybe a little pain, but it would be at the incision site. As far as the back pain, I don't feel what I was feeling before. And a lot of that is probably because I can't bend, which I think another one of my problems, which made my back worse, was the fact that I can't squat. Um, I think the ligaments are gone in my knee, and I think it's pretty much bone on bone. So it hurts really bad, and I can hear it pop. It pops sometimes, both knees, but more than pop, they lock up on me, and I can't stand up. And I think if I was able to squat, then that would take less stress off my lower back. But because I can't do that, when I have to pick something up from the ground, I can't squat, so I would have to bend to pick that up. um I am scheduled to see my surgeon again, for my post-op visit, December 9th. And I'll give an update um before then, of what I'm going through, and hopefully this will help someone else. But I can say this: I could not have lived the way I was living. I had no quality of life at all. Um, and now, just the possibility of me getting my life back, look at my face. I mean, it puts a smile on my face, and I'm so excited. And I don't want to rush to the point that I hurt myself. I still can't bend. So anything that falls on the floor, it's there until someone comes that can bend. Because, like I said, I can't bend, and I won't be bending. Um, of course, until my doctor say that it's okay. I can't do any housework. I can't push a vacuum cleaner. I can't sweep the floor, which kind of sucks. Because there's things that I'm looking around, and I'm like, I need to do this. I need to do that. Um, so that's pretty much where I am right now. Overall, after this second surgery, I would say I feel, if I had to rate it from 1 to 10, I'd say I feel like a 5. After the second surgery. After the first surgery, I felt like a 9 after the surgery. Um, and I was sent home, and I had to deal with that pain for a little over a year, like 18 months. They were the worst 18 months of my life. So if you're getting the sciatic nerve pain that I had, grabs you in your butt cheek, and it goes right down the back of your leg, the hamstring, right into the calf. It does not stop. It is a constant thing. I thought the muscle spasms in my neck from my I've also had a cervical laminectomy with instrumentation, C4, 5, and 6. Um, those muscle spasms weren't anything compared to the pain of the sciatic nerve and the muscle spasms that they were causing in the Charlie horses. Honest to God, it was the absolute worst pain of my life. I wouldn't wish it on anyone, regardless as to what they did to me. I would never wish anyone this kind of pain. So again, if this video helps somebody, then that's great. And if not, hey, I tried. Um, that's it. I'll talk to you guys again, probably in 3 more days.